Dear students, welcome back. Now we are going to discuss about rectus sheath. There are two rectus sheaths, one on each side of the linea alba, or this is an aponeurotic sheath covering the rectus abdominis, and it is having anterior wall and the posterior wall. If you see the features of the anterior wall, so this one is the rectus abdominis muscle. The anterior wall is complete, covering the muscle from end to end. If you see this anterior wall, this one is the anterior wall. The anterior wall is complete from end to end. And its composition is variable. It is firmly adherent to the tendinous intersections of the rectus abdominis muscle. So this anterior wall is firmly adherent to the tendinous intersections of the rectus abdominis muscle. And coming to the posterior wall is incomplete, being deficient in the costal region, costal margin, and also below the arcuate line. Arcuate line is nothing but the line between the upper 3/4 of the muscle and the lower 1/4 of the muscle forms the arcuate line. Okay, so it is incomplete, being deficient above the costal margin and below the arcuate line. That means the posterior wall is not well defined above the costal margin and below the arcuate line. Okay, and this composition is also variable and it is free from the rectus muscle. So this posterior wall is not attached to the rectus muscle and it is free from rectus muscle. Whereas this anterior wall is firmly adherent to the tendinous intersections of the rectus muscle. Okay, coming to the medial wall. So if you see, this is the rectus abdominis muscle. Okay, this one is the medial side and the lateral side, and this is the lateral side of the another half. Okay, right and left. So this one is rectus muscle and other half of the rectus muscle. Okay, so the medial wall is formed by the fusion of all the aponeurosis in the midline. All the aponeurosis in the midline. It is called as linea alba. And the lateral wall is formed by the linea semilunaris. The lateral wall is also called as linea semilunaris. It extends from the tip of 9th costal cartilage to the pubic tubercle. 9th costal cartilage to the pubic tubercle. Okay. So these are the walls of the rectus sheath. So this is rectus sheath is an aponeurotic sheath covering the rectus abdominis muscle, and it is having two walls. One is anterior and posterior wall, and it also having medial and lateral walls. Okay. Now we will see the formation of the rectus sheath now. So here the formation of the rectus sheath is different in the following regions. So as we have seen that this posterior wall is not well defined above the costal margin and below the arcuate line. That means there is some difference in the formation of rectus sheath in different regions. It is not same as that of from top to bottom. Where such kind of differentiations can be seen. So now we'll see this formation. The formation of the rectus sheath is different in the following regions. Above the level of the costal margin is the one region where you can find some difference in the formation of this sheath, and the second formation of this rectus sheath is between the level of the costal margin and the umbilicus. Okay, costal margin and a point midway between the umbilicus and the pubic symphysis. That means it will come here. Okay, so you can see that peak here. Yes. Now here you can see the first formation of this rectus sheath is above the costal margin. So this one is the above the costal margin, and next formation is this one. So this is the level between the costal margin and a point midway between the umbilicus and the pubic symphysis. Okay, so this is the second formation of the rectus sheath, and the third one is below the midpoint between the pubic symphysis and the umbilicus. So that means here again you can see this. Below this midpoint is nothing but the arcuate line. Okay, so this below this arcuate line to pubic symphysis is the third formation of the rectus sheath. Now we will see one by one. One is the above the costal margin. That one we can call it as region 1. In this region, the anterior wall of the sheath is formed by the aponeurosis of the external oblique. So here you can see this one is the first one. If you take the transverse section above the level of the xiphoid process, that is the costal margin, you can find such kind of transverse section. So this one is the anterior and this is posterior. So anteriorly, the anterior wall is formed by the aponeurosis of the external oblique. Okay, only external oblique muscle aponeurosis is taking part in the formation of anterior wall in the region 1. Okay, now coming to the posteriorly of this region, posteriorly the rectus muscle is resting directly on the ribs and costal cartilages. So 5th, 6th and 7th costal cartilages. So it is resting directly on the costal cartilages of 5th, 6th and 7th ribs. Okay, this is the formation of rectus sheath at the first region, that is above the costal margin. Now coming to the region 2, that is midway between the costal margin and simply we can call it as arcuate line. Okay, so in between then how this rectus sheath is formed. In this region the rectus sheath is complete. In this region the rectus sheath is complete. The anterior wall is formed by the fusion of the external oblique aponeurosis, and so here another important thing, the internal oblique aponeurosis is divided into anterior laminae and posterior laminae. So in the second region the anterior wall is formed by the aponeurosis of the external oblique and the anterior laminae of the internal oblique aponeurosis. Okay, now the posterior wall is formed by the fusion of posterior lamellae of the internal oblique muscle aponeurosis with the aponeurosis of the transverse abdominis muscle. So here all the three abdominal muscles are taking part in the formation of the rectus sheath in this region. So anteriorly it is formed by the fusion of the aponeurosis of the external oblique and the anterior lamellae of the aponeurosis of the internal oblique, whereas the posterior wall is formed by the posterior lamellae of the internal oblique and then the aponeurosis of the transverse abdominis forms the posterior wall. Okay. Here and this, the aponeurosis of the internal oblique divides into anterior and posterior lamellae at the lateral border of the rectus abdominis. So such division of this aponeurosis can be seen on the lateral border of the aponeurosis. Okay, now coming to the region 3. So that is below the arcuate line. In this region, the anterior wall of the rectus sheath is formed by the fusion of the aponeurosis of the external oblique, internal oblique, as well as transverse muscles. All the three oblique muscles aponeurosis are taking part in the formation of anterior wall, and then the posterior wall in this region is deficient. Okay, the posterior wall of the sheath is deficient in this region and the rectus muscle is directly rests on the fascia transversalis. So that is the next layer of the abdomen. Okay, so this rectus abdominis muscle on the posterior aspect, it directly rests on the transversalis fascia. Okay, so the free lower border of the posterior wall of the rectus sheath presents as the arcuate line midway between the umbilicus and the pubic symphysis. That is called as below the arcuate line. Okay, so these are the levels of the formation of the rectus sheath. Okay, so how the walls are. Okay, so lateral wall is by this linea semilunaris and the medial wall is by the linea alba. So that is common for all these regions. Okay, now coming to the contents of this rectus sheath. So this rectus sheath contains the rectus abdominis muscle, one thing, and also at the lower level it also covers the pyramidalis muscle also. Okay, so the chief and largest content in the rectus sheath is rectus abdominis muscle, and it also lodges the pyramidalis at the lower part. Okay, next coming to the arteries. So the arteries, mainly the superior epigastric artery and the inferior epigastric arteries. So these two arteries are present in the rectus sheath. Okay, this superior and inferior epigastric arteries form an anastomotic chain on the posterior wall of the rectus sheath. Okay, now coming to the veins, it also lodges superior epigastric vena comitans which accompanies its artery, that is superior epigastric artery, and the inferior epigastric vena comitans which accompany the inferior epigastric artery, and this join the external iliac vein. So these are the contents, and coming to the nerves which are present inside this rectus sheath, or these are the terminal parts of the lower 6 thoracic nerves. Lower 6 thoracic nerves, which including lower 5 intercostal and the subcostal nerve. Okay, mainly the terminal parts of the 5 intercostal and subcostal nerves. So these are all the contents of the rectus sheath. Now, what are the functions of this rectus sheath? It checks bowing of rectus muscle during its contraction, and thus increases the efficiency of the muscle. It also maintains the strength of the anterior abdominal wall. So this is all about the rectus sheath. In the next session, we are going to see fascia transversalis and also this inguinal canal. Thank you.